So our today's lecture is just a brief overview of the research studies as I mentioned on the cover slide: cross-sectional study, cohort, case control, case reports, meta-analysis, letter to editor. Basically, what is the meaning of these studies and how can we proceed? As our time is very limited and short, we can have later sessions of each study separately and go into the depth of these studies, like their how to do their writings, how to do the analysis, and all that stuff. But this lecture is very brief, just an overview, so that people who are just at the beginner level and who are just started learning it and who have no experience at all can feel some confidence after this discussion, and they can at least start understanding the studies while reading them. Are you guys able to see my screen, the slides?
Yes.
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 So this is the picture thinking aloud, which I found on the internet today while making slides. I was not going to make slides, but Dr. Anwar suggested that I should. So I just, in the short time, I made these a few slides, like 10 to 12, because I am also preparing for my step 2 exams. So I have limited time. This picture thinking aloud very attracted me so much because many people, including me, when I was starting, when I started learning, and when I was in the initial phase of learning or doing the research, I was like just sitting and thinking that someone would come and bring a topic to me and say, just collaborate with me, and I will be like, okay, I can do this, just assign me work. But that is not how it worked. uh, I waited for many months on this stupid strategy, but this is now how it worked. Then I had to go talk to my professors at the college, even though I am graduated. And I went back to my college. I talked to professors. Then I talked to few mentors. I took workshops again, and I had to take the initiative. And then the things started to work, and I worked on 4 to 5, or I think 5 to 6 articles till now. So you have to start thinking. There is no harm in it. No one will make you feel embarrassed. You should not feel shy about it. Just start thinking. Read the article. Come up with any topic, even if you think it's not effective enough or anything. Just come up with it. Talk to any person with experience. Talk to any mentor. Discuss it in the group or separately. You will learn something out of it. It will not go in vain. Trust me. And before moving forward, you should know and you should be clear in your mind that why are you learning here today? What is your motive? What do you want to do? Most of the people, as we all know, are here for their publications, for the match, making their profile better, CVs look better. That is the truth. And for that, you will need the publications in shorter time, better publications in PubMed index journals, or with more effective people. But some people, okay, let me add this. Okay. But some people also like to have, like they're who are in the field ahead of ours. They are really into research stuff. So they will be like into clinical trials or long case control studies or retrospective or prospective cohort studies. Those are time consuming. So basically, what are the uh, various types of research studies at the basic level? Cross-sectional studies, cohort studies, case control studies, meta-analysis, clinical trials. Mr. Abid, please do not do this again. Thank you. Clinical trials, case reports and case series, systemic and narrative reviews, letter to the editor, or there could be others like CDC Wonder workshops. That is a bit advanced, but we can discuss it later in some other session. I was lucky enough to have experienced it and do an article on it. I'm also planning to do another one, so I will post a topic regarding it in our group. So people who do not have much experience and who are not familiarized much with the terminology. This cross-sectional study, what is cross-sectional study? This is a very basic study, observational study. It's mainly a questionnaire-based study. Like I did two cross-sectional studies till now, and one of it was like the factors which are which are causing psychological insulin resistance among the patients with type 2 diabetes mellitus. So that is a very straightforward questionnaire-based studies. We formed a questionnaire. We went to the patients, filled it ourselves with their permission, of course, and then collected the data and did the analysis and all the writing stuff. So it what does cross-sectional study shows? It shows the prevalence of a prevalence. For example, I've given a very basic example here, the prevalence of lung cancer among the smokers. And it's very easy and quick study. It is also called snapshot study. One thing which you need, which you must have in your mind is that it's a present time study. You will never have to follow up in future or in the past. It's just a present time study, like prevalence of lung cancer among smokers. What is the frequency of the disease in the present times? Am I clear?
Yes.
Yes.
If there's any point you want to ask, you may ask. This is just very basic lecture for the beginners. Next is cohort study. Cohort study is what points you need to have in your mind if you are done with your exams, and some people who are preparing for their exams also, they also need to know just very basic points for this, like it's the incidence study. Cross-sectional was a prevalence study in one present time. Cohort study is an incidence study. It shows the causal relationship and it moves in time either forward or backward. Forward will be prospective and backward will be retrospective. Just like there is this figure here. And one thing which is important and you should always have in your mind to differentiate it from other studies, that it will move from exposure towards outcome. For example, the exposure here could be smokers, non-exposed could be non-smokers, and then you will follow them in the time. For example, you set a time period of 5 years, 7 years, or 10 years. You will follow them with outcome like smokers who developed lung cancer or smokers who did not, and then non-smokers who developed and non-smokers who did not. Is it clear?
Yes.
You need to have a concept here of prospective and retrospective cohort. Prospective will be moving forward in time. Like from today is 4th April 2024, you set up a time after 5 years and in 2029, your study will be concluded. Retrospective cohort is you will go backward 5 years, like from 2024 to 2019, and you will see the data of smokers or non-smokers who developed lung cancer in the last 5 years. This is important to know because many people confuse retrospective cohort with cross-sectional or with case control. So you should have this concept. And what does it show? It shows the relative risk determination. These are the statistical concepts which will be discussed in individual studies in some other sessions, or if any one of you have any concept regarding them, you can also conduct a discussion lecture like this and we can have other sessions. It's also my first time, so please just start doing anything. Next is case control study. Case control, you have two groups, as its name shows, cases and controls. You have to do the comparison of those two, like I have shown here. But here, there is opposite of cohort. You are going from outcome towards exposure. This difference between the two should always be in your mind, even while you are reading any article, you are conducting any article, or you are preparing for your exam, or you are even talking about your article or anything to anyone related to research. You must always be clear about this. So you will divide the people in two groups, control group and case group. For example, people with lung cancer in the case and people who do not have lung cancer in the control group. And then you will see if they were exposed to smoking or if they were not exposed to smoking differently in the both groups. And what you will determine, the odds ratio, that what were the odds in the lung cancer group and what were the odds of exposure in the non-lung cancer group. Am I clear?
You're very
Yes.
clear so far. Thank you.
Thank you. So this is the slide which I made to actually show the differences and clear the concepts of cross-sectional, retrospective, and case control, because many people, even when I was studying and I was preparing, I also had confusion regarding this because people confuse it. Always remember in cross-sectional that there is no time frame. You are just conducting the study in the present time. You do not have to follow up in the future. You do not have to go in the past. Just like patients with lung cancer, simply who smoked. You will go to a patient with lung cancer, you will ask if you are a smoker or non-smoker, and that's it. You will mark it on your questionnaire. You have your data. You do not have to follow up him in the future. In retrospective cohort, you will have to go to the cohort means from exposure to outcome. You will go to the people who are smoking and people who smoked developed lung cancer in the last 5 years. You have to show you have to set time frame, and then you will have to follow up their data. You will go to a clinic or hospital, take permission, and check the data. In case control, as I already told you, you will divide the people into two groups, cases and controls, and then you will just find out if the people with outcome like lung cancer or people with outcome with no outcome having no lung cancer were exposed to smoking or not. And this will give you your data, and then you can move on with your analysis and writing. Is the difference clear?
Yes, sir.
Yes.
Thank you. Next is case reports and case series. Very easy, very less time consuming, easy to publish, and you do not need a lot of people for doing this. No need to make a very big team for it. 4 to 5 people, or I think usually 4 people are enough for a case report as to display as others. It is also type of descriptive studies. You should know if there is any rare disease or if any common disease with a rare feature which is not very common in the population. You do not have to look for a global population. You can even say that this disease is common here. Just for example, diabetes, very common disease in your area. But there is a feature which is not very common for diabetes, and you find it. You find it in that case. So you can also write a report for it. Is it clear? And it's not compulsory for it to be a rare disease. It can be any rare side effect of a medication. Some side effects of medications are reported, which we read, which are available in the literature, which are reported by the pharmacological companies. But there could be a rare side effect. You can also write a case report for it. Usually case report is contains 1,000 to 1,500 words, and it doesn't need to be very lengthy. You need to be very good in writing for it so that you convey your case in very well formed report. And case series is basically a group of patients with the same disease, and you will follow them. You will follow their symptoms, their clinical presentations, their diagnostic labs, their treatment, and how well they how well the treatment showed its effectiveness. This will be case series. Similarly, letter to the editor, it's also very easy to write. You do not need a lot of people. You do not need a lot of data. You can it just needs studying of the articles which are already available. You will study the article, and if there is any new discovery or if there is something you want to add to that article, If there is any suggestion you want to make, so you can just write the letter to the editor, and it should be very well written and between 300 to 500 words usually. It is very short and quick publication. You do not have to wait for data. You do not have to wait for doing the analysis, the mathematical work, and getting it checked. And also, you do not need ethical approvals for it. So it's very easy and good for quick publications, which can be very fruitful for the people who are applying in the math cycle this year. Next is meta-analysis. Meta-analysis is very valuable study as it combines different studies from different regions, and it's very valuable. For doing meta-analysis, you should have a setup PICO, PICO, P for population should be same in all the studies you are including. Intervention should be same in all the studies you are including. Control groups should be same, and outcome of all the studies you should same. When you are doing the literature search for adding studies in your meta-analysis, you must look for these 4 things. So you will include that study in your meta-analysis. Otherwise, you will have to exclude that study. You can. Hello. Hello.
Hello.
My
Hello,
internet was interrupted.
it's all right. We can understand.
Okay. So am I clear till now?
Yes, bro,
Yeah,
very clear.
Okay. Thank you. I hope it's helpful for
I
you.
just wanted you
Yes.
to repeat case series. I didn't get that.
Case series. Okay, let
Yes.
me get back to that slide. Case series is basically just like its name says, series. You will find group of people, group of patients who have the similar disease. And then you will prepare a report and different cases of all of the patients, and you will combine them and you will present it. For example, just as an example, there are in a clinic, there are 10 people with rheumatoid arthritis who present with different features. What you will do, you will gather the data of all those 10 people, their presenting complaints, the duration, the clinical features, the diagnostic test you did, and the treatment you provided them, and what did the treatment do to them. And then you will form basically a report, but of number of patients with the same disease. Does it make sense now?
Right. So the disease remains the same, but the presentation differs. That's how we're going to collect the
It
cases,
could
right?
be, yes, could be.
Okay.
Okay, so we discussed about the meta-analysis. The one thing meta-analysis it's valuable, but what is favorable for the people like us who are doing it is that you do not need to go to hospitals to collect data. You do not need to send questionnaires in various groups to collect data. The data is already available. You just have to do your literature search, combine it, and analyze it. If you are active, your team is active, and your mentor is active, it can be done in 1 month or maximum 1.5 or 2 months. There are other also types of the researches like narrative review, systemic review, or CTCs. But due to the limited time, we will just be briefly discussing these. And next thing I want to discuss is how to come up with a topic which is important for right now. But before doing that, you should be very clear that why you are doing your research. Okay, my internet is unstable. Can you guys listen me? Am I audible?
Yes.
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 All right. Thank you. Now, before starting your project, you should be very clear about it, that you want to do it. What is your motivation? What is your reasoning behind it? So you do not be you should not be lazy while doing it, and you should not quit I have seen many people who started, even I started a cross-sectional study with one of my fellow. Okay, we have 10 minutes left for the session. I was doing the cross-sectional, but he started it and then he stopped it in the mid because there were previously there were, if you know, there were marks for in the CPS, PFCPS conduction. Later, they removed it, so he stopped and quit the research in mid. So your motivation and your reason behind it should be very clear so that you can finish it because it is where it can take a lot of your energy research. Mainly if you are doing it with a lot of people because some people do it effectively and some do not. Now, how to come up with a topic? At the very beginner level, one of the difficulty which most of us face is coming up with a topic. Even when we go to mentor, he or she says, suggest me a topic. This is very normal and this is the routine. So what mostly we do, we say, please add me in, collaborate with me. I'm interested, I will do the work. But what work? Everyone will not just come up with a topic, so you have to come up with a topic. In the initial stages, how did I come with a topic? I searched, for example, I opened PubMed or Google Scholar, and I am interested in internal medicine and its subspecialty. So I just studied endocrinology, cross-sectional endocrinology study. So there are a lot of studies come up, for example, in the different regions of the world, in Nepal, in Bangladesh, in India, or in any Western country. So a study conducted in Nepal, you can conduct that study in the region of your city in Karachi, in Pakistan. So there a topic, or you can read other. This is not copying it. You just took a copy of suggestion, and you are now going to conduct a whole new study on the people of your area. Am I clear? Hello.
Yeah.
So with this strategy, you can come up with a topic at the beginner level. Later, when you start studying the researches, when you get involved in it, you can come up with your own idea while you are studying for your step exams, you study the diseases in depth, you study their treatments, pharmacology in depth. So you can also start coming up with your idea. Your idea could be useful or not, but just please suggest it to the mentor. Because at this level, we do not know what can be beneficial, what can be good enough. So just give the suggestion. Please do not hesitate. Please do not hesitate. Once you have come up with idea, discuss with his mentor. If he likes it, if he approves it, you will have to go to the ethical committee approval. Different colleges have their own committees. I approved it from the committee of my college. You can approve it from the committee of your college, fulfill their criteria, or even from other college. It is not necessary that you have to go to your own college from where you graduated. You can go to any other college also. Form a team. Making a team is very helpful because you are also busy doing other tasks. So what you will do, you will start on 1, 2, or maybe 3 projects at a time. You will do your part, learn about the other things also, but you will be done with your part and then you can move on with anything else. You will have to give like a half hour or 1 hour daily. You won't have to uh, give your 24 hours, months and months to a project. Make a good team, do a good teamwork, divide the work, and do many publications in a shorter period of time. Now, once you have decided, you have taken your approval from the committee, that is the most difficult time is the finding a suitable topic, getting it approved. Once you have your topic, you know what to do, you know how to proceed, you have your approval. Rest is just dividing in the team, writing an introduction. One will be writing the introduction, one will be writing the abstract, one will be doing collecting the data, other will be analyzing the data, and one will be writing the discussions, conclusions. So it's rest of that is just your hard work, how effectively and how quickly you do it. Main thing is how you when you initiate your project, when your topic is selected, when you have gotten your approval, when you have started the work. That is the main thing. Once you are done, you will go to different journals for approval. You will get rejections. We recently did receive a rejection for our meta-analysis, and now we are applying to different journals. But please do not be demotivated by it. Stay motivated. It doesn't matter. Just start doing it. Keep doing it. Do not stop. Please do not stop. And when you are done with it, uh, give the due credit to your team members and the mentor. Be grateful to your mentor all the time, who are very genuinely helping us out of without any charges. Mostly mentors are not taking any charges, so we should be very grateful to them for their. And just like we are in need of help, many people we are still in need of help. We are learning, and many people in the future will also be needing this help. So be helpful towards them and play the good role. So I hope this very brief session was helpful, as we had limited time and we are all also preparing for other exam or stuff. And I will not take more time. If there is anything you want to ask, please. If you want to share any of your experience, please share it. I'm sorry.
No,
Who is it? Is there anyone who wants to ask something? Is there anyone who wants to ask something, or should I end the meeting?
I think somebody was accidentally unmuted. I have a quick question if you have a minute.
Yes.
So you have said that we have to get the topic approved by the committee in the college. What about the students who have already graduated and they're like, for example, an old graduate? So where should they go to get this role? Whom should they contact?
Yes, the people, just like I gave my example, I went back to my college and I talked to my professor and I went to the committee and I got it approved. You can, if it's feasible for you practically to go to your college, you can go to your college. It doesn't matter if you are graduated or not, or you can ask any other member of your team member to go and approve from their college or any other college. It doesn't matter if it's your own college. It must be approved mainly for cross-sectional studies, cohort cross-sectional studies, meta-analysis, letter to the editors. These do not need approvals.
Okay, thank you so much.
Should I end it now, or is there anyone who wants to share something?
And that's it.
Thank you. Thank you for listening, everyone. Thank you. Thank you so much. I hope I was a little bit helpful and you have gained at least something from out of it.
Thank you,
so
Dr.
much.